Welcome, Tungasugisi. I now give the floor to Ms. Allison Kelliher.
Anamasi Nisne, Kuyana. I thank you very much for this opportunity to humbly speak before you about evaluating institutional structures through the Indigenous Determinants of Health Measurement Instrument. You'll see in the next slide our overview and background. This study aims to implement and evaluate specific measurement tools and provide guidance and track efforts that center Indigenous rights, cultural safety, and the Indigenous Determinants of Health. It expands on 2 previous Indigenous Determinants of Health studies, which provided a conceptual base and summary of structural factors impacting Indigenous health. The Indigenous Determinants of Health study was developed in 2023 by 35 scholars in all 7 socioeconomic regions as a response to the apathy, lack of education, and systemic shortcomings that UN agencies have shown in terms of cultural safety and compliance with Indigenous rights as per the provisions included in the UN Declaration on the Rights of Indigenous Peoples. These studies identify indigeneity as an overarching determinant of health and encompass 17 protective and 16 risk factors that influence Indigenous health outcomes. These unique factors are organized under 3 themes: intergenerational holistic healing, the health of Mother Earth, and re-indigenizing and decolonizing culture, which are also included in the evaluation study that I'm presenting today. Next slide. This evaluation study presents a transformative tool designed to evaluate and improve institutional responsiveness to Indigenous peoples' health and well-being, including how well national and international entities align with the principles of cultural safety, aspects of equity, and Indigenous rights as laid out in the UN Declaration on the Rights of Indigenous Peoples. Mainstream evaluation frameworks and narratives often fail to account for the holistic concept of health as understood by the Indigenous worldview. The evaluation tool is structured as a 20-item scorecard grouped into 4 thematic sections. The intergenerational holistic healing, the health of Mother Earth, decolonizing and re-indigenizing culture and systems, and finally, institutional compliance with Indigenous rights. Each item is rated on a scale of 0 to 3, with total scores offering a benchmark of institutional performance. The range of performance is excellent, good, needs improvement, or poor. Next slide. As the first example of an evaluation item, promotion of Indigenous traditional ancestral medicine, our indicator is support for Indigenous communities to implement these types of practices in our communities. The metrics for measurement include agency guidelines to protect, respect, and foster not only practice, but also the expansion of traditional medicinal methods in Indigenous communities. Also, grants and resources that allow this effect are included, and the scores include high, medium, low, or very low, depending on whether existing policies, some support, minimal awareness, or no resources are allocated. Next slide, please. The next evaluation item is incorporation of land, ecological, and environmental components into Indigenous peoples' projects, and this indicator includes initiatives and resources that safeguard stewardship and management of natural elements, while incorporating ecology, water, land, and air components into culturally safe activities. Our metrics involve fostering the protection of and respect for Indigenous communities to own, manage, and govern over their own ancestral lands and resources in a sovereign fashion. I'd like to emphasize sovereignty in this case. Availability of resources help us stay connected to our environment and our community and help us to care for the planet. The scoring is similar: high, medium, low, or very low, depending on whether efforts are well-resourced, partially or potentially resourced, or whether there are no discussions. Next slide. Finally, the implementation and path forward includes forming an advisory group with Indigenous leaders, orienting and training to understand cultural and technical aspects, adaptation to local contexts through community consultation, further, pilot testing for feasibility, which is really what we need to partner with you, other Indigenous peoples and organizations in order to do, and full implementation using participatory and community-led assessments, as well as collaborative data analysis and developing action plans for ongoing monitoring on these scorecards. The path forward includes that the scorecard is a living tool and it requires our involvement to refine this scorecard with Indigenous peoples' feedback and involvement. Future improvements will expand and scale the use of this scorecard, and it aims to support systemic change and health justice for Indigenous people. Anamasi Koyana. Thank you.
Thank you. I thank Ms. Kelliher